2013, I had a car accident. The airbag burst in front of my face and it ruptured my left eye.
I lost my eye when I was 1 year old. I got a bit of glass in my eye and quite a severe infection after that. And unfortunately the eye couldn't be saved, so it had to be removed. And I've worn a prosthetic eye over 55 years now.
My eye suffered a fair bit of inflammation. I was sick for quite a few years. I was managing it with drops and pain medication, and it was deteriorating a fair bit. And so we decided that it was time for the surgery.
My name is Alan McNabb and I'm a senior eye doctor here at the Eye and Ear Hospital in Melbourne. I'm going to talk to you about surgery to remove an eye. When having an eye removed, it's completely natural to experience a variety of emotions, such as fear, anxiety, grief, and stress. Talking to your loved ones and carers about these emotions will help you, and if you feel you need professional counselling, this can be arranged through your general practitioner. Enucleation is the surgical removal of the entire eyeball, leaving behind the bony cavity or eye socket, the eyelids, eyelashes, and muscles at the back of the eye. A variation of this surgery is evisceration, and this is where only the contents of the eye are removed, leaving the white part of the eye, known as the sclera, and the eye muscles intact. Some of the most common reasons for these procedures include cancer, severe infections inside the eye, injuries, a painful and blind eye, or for cosmetic improvements in an eye that is otherwise blind and disfigured. Your surgeon will help you decide which surgery is the most appropriate for you.
I've looked after a lot of people that have come into the hospital to have their eye removed. You need to have a good and open conversation with your specialist and understand all the pros and cons.
The doctors gave me all the instructions. It was very clear what was going to happen.
Obviously, you can read some literature or look at some videos and there's a time frame.
I think it's really important for patients when they're looking for information that they go to a reputable source of truth, so a hospital website where the information will be readily available and current.
Family and friends, I think, was the support that I had, and knowing that my ophthalmologist had sort of prepared me.
There are a number of stages to the enucleation process, and staff at the hospital will assist and guide you through each of these stages. The waiting time for enucleation surgery depends on how urgent it is for you to have the procedure. Once you've agreed to go ahead with the surgery, you'll be booked in for your procedure. Before your procedure, you'll require a pre-admission assessment. This could be a visit to a clinic at the hospital or a phone call from a pre-admission nurse. And during this assessment, you'll be told when to stop eating and drinking before surgery and which medications to take or stop taking. Surgery is performed in the operating room and takes around 1 to 2 hours. It's mostly done under general anaesthesia, although it can be completed safely using local anaesthesia with sedation also. Your anaesthetist will discuss the best anaesthetic option for you before your operation. During the procedure, the eyeball is removed from the socket, leaving behind the eye muscles. A small round orbital implant, similar to this, is inserted into the socket to replace the tissue volume lost when the eye is removed. The eye muscles are connected to the implant and it's then covered with conjunctiva, which is your own tissue that lines the eyelids and the white part of the eye called sclera. The muscles that are connected will move the implant, and this will give some movement to the artificial eye, which will sit on top of the implant like a shell or a thick contact lens. So here is an artificial eye. It sits over the implant, a bit like that. Unlike the artificial eye, the implant can't be taken in and out. This is a conformer. It's a thin plastic shell placed in the eye socket at the end of the operation to help keep the shape of the socket and to reduce swelling. The conformer usually stays in until you have your permanent artificial eye made, which will happen around 6 weeks after surgery. Sometimes the top and bottom eyelids are stitched together at the end of the operation to help reduce swelling also. At the end of the surgery, a large pressure pad will be placed over the operated eye. This helps to reduce bruising and swelling also, and that pressure pad is kept in place for about 2 or 3 days. Once the procedure is complete, you'll go to the recovery room to be monitored, and once you're stable, you'll be taken to the inpatient ward to be cared for. Most patients are discharged the following day. However, sometimes patients do stay an additional day or 2 if required. It's normal to experience some pain after the operation. It's important that you advise nursing staff if you experience pain so they can administer the appropriate medication to keep you comfortable.
The sensation post-surgery was a little bit scratchy. I had the conformer in place. It's quite confronting to see yourself without an eyeball there.
Wanted to know how it'll look like when he removes the eye, which was worrying me a lot.
Once I got home, the process was to ensure that I was taking the drops, putting the drops in, resting, not moving the eye around too much, and just looking after yourself, eating well and staying well.
The recovery time was very long. It was about 6 weeks. First 2 weeks was a bit painful, but with medication, managed the pain very well.
Resting and reducing the movement of your remaining eye in the first few days after surgery will help with your healing and comfort. On discharge, you will be prescribed ointment and/or drops to use in the socket to help prevent infection. This will commence after you remove the pressure pad. Even if the area is still swollen, it's important to apply the ointment or drops, so you may need someone to help you. After you've removed the pressure pad, you may find it more comfortable to continue covering the socket with a small eye pad. This can help with managing any watery discharge from the socket, which is normal. If the eyelids and lashes feel crusty or sticky, you can gently clean them with a saline solution and cotton ball. The nursing staff will explain how to do this as part of your discharge education. A follow-up appointment will be made for 1 to 3 weeks after surgery. The surgeon will examine your eye socket, remove any stitches in the eyelid, and advise you when you can resume normal activities and when you need to have your artificial eye made.
I was a bit impatient. I wanted it to sort of heal and get better, and so I could get my prosthesis. The thing that was reassuring for me was I knew that within 2 months' time I would have a prosthetic that would match my natural eye. Be optimistic, because you'll be glad that you did it.
I hope this video has helped you. More information can be found on the Eye and Ear Hospital's website. Thank you.